All right, team. We saw way too many people throw away money in 2025 on things they didn't need to pay for. So let's make sure that doesn't happen again in 2026. We're going to go down the whole list here of all the places you or your loved ones or your community, neighbors. So I'm going to go through this list, and then we've got a bunch of questions on survivor benefits and when to start retirement benefits and overpayments and all that kind of stuff. So, but we'll get into the topic of the day. And if you're watching, you're part of the community. How do you become part of the team? Is you go out there and help other people. So you switch from community to the team is when you take this information and talk to your neighbors and friends and family and make sure they're getting everything they're eligible for and they're able to navigate the nasty bureaucracy that is the government. Okay, so let's start it off. We're going to focus on Medicare, but also a little bit of the Affordable Care Act. And if you've already got a Medicare plan, the last part here, persistence, is extremely important, but I think they're all important for particular audiences out there. Okay, number one is the Medicare SEP. This is the big one that really a lot of people miss, and they pay for Medicare when they don't have to. So if you are approaching 65, there's a lot of people. 11,000 people are turning 65 every single day. It's crazy. Baby boomers, 1946 to 1964, 70 million Americans born between that time. 11,000 people turning 65 every day. And they're wondering, do I have to sign up for Medicare? As we used to say in the Marine Corps, you don't have to do anything in life, but the repercussions are the repercussions. So the repercussions are if you don't sign up for Medicare at 65, Part A and Part B, then yes, you will be penalized for the rest of your life. 10% for every 12 months you did not have health insurance when you were supposed to sign up for Medicare when you were supposed to. But here's what people think. They say, okay, I guess I have to sign up for Medicare. I don't need it. I've already got health insurance from work. There you go. You don't need it. Don't waste your money if you have health insurance from work, your work or your spouse's work. And that employer has to have 20 or more employees. So that's the key. It has to be current work. It can't be a retirement plan or the Affordable Care Act or whatever the case. It has to be from current work, yours or your spouse's. And that employer has to have 20 or more employees. And what happens is, do you have to sign up for it? Is it automatic? It depends on your particular situation. If you're currently receiving Social Security benefits, a monthly check, retirement benefits, spouse benefits, independently entitled divorce spouse benefits, surviving spouse benefit, whatever you're receiving, about 100 days before you turn 65, Social Security will sign you up. Medicare will sign you up for Medicare Part A and Part B automatically. You don't have to do anything. If you're already receiving a check, it's automatic. And at that time, you actually have to do something. If you have health insurance from work, you have to return the Part B and say, I don't want Part B because I currently have health insurance from work and I don't want to spend $202.90 per month if I don't need it. You have to keep Part A. That's zero premium anyway for most people. So you keep Part A, but you refuse Part B. You don't get Part D because you have health insurance from work and you're golden. Once you stop working, you or your spouse, and you stop receiving health insurance from that work, then you sign up for Medicare Part B, the one that costs you money on a monthly basis. And you just have to fill out a couple of forms. It is, let me go ahead and I've got a website that's got all that information on there, but you can also go to ssa.gov as well. So you go into my website, it's mygovexpert.com. Click on the enrollment periods, and what we're talking about is the special enrollment period. So if you're 70, 75, 85, 95, and you just lost health insurance because you stopped working, no penalty whatsoever. If you had health insurance all the way since you turned 65, you've got 8 months. Don't. You technically legally have 8 months. Once you lose your health insurance from current work, you have 8 months. But you know what happens when you don't have health insurance for 8 months? Yeah, you don't have issues for 20 years. And then when you don't have it, that's when, somebody runs into you or whatever the case may be. So about a month or two before you're going to stop working, then you sign up. And there's a couple of forms. There's the 40B and the 564. I've got them right there. You can download them, or you can download them on the website, ssa.gov or wherever the case may be. And you just have your employer fill out the one that stops the penalty. that says, yeah, this person has had health insurance from current work or the spouse's work since they turned 65 years old. Now they're 67 or 68 or 88 or whatever. Don't penalize them, and you don't get a penalty whatsoever. So no issues whatsoever. And this also applies to people that are receiving Medicare for disability. If you're receiving Social Security disability insurance, then you get Medicare after being on Social Security disability for 2 years. So for 24 months, you have to have Social Security disability, SSDI, not SSI, SSDI for 2 years, and then you get Medicare automatically as well. Okay. All right. Let's get into the next one here. If you've got any questions, specific questions about that, let me know. There's all kinds of small little details that some people mess up on. All right. So don't pay, long story short on that one, don't pay for it if you don't need it. If you're approaching 65 and you're not receiving any type of Social Security benefits, people ask, well, do I have to contact Social Security and refuse? No, don't waste your time. If you're not receiving Social Security benefits, you won't be automatically enrolled in Part B, so you don't have to call Social Security and say, hey, I'm 65, I'm not receiving benefits, but I don't want Medicare. You don't need to call Social Security. We used to get people call in our office all the time and say, we don't want Medicare. It's like, okay, bye. You don't need to waste your time calling because the AI robot is probably going to pick up anyway. So anyway, that's a whole different issue I will address. I think I'm going to talk about that tomorrow. Be very, very careful of the AI robot in 2026 adjudicating your retirement claim. Yeah, there's going to be big issues with that one. I'll get that off my chest tomorrow. Anyway, Medicare Savings Program. Team, we need you to go out there and really work on this one. The Medicare Savings Program. I know you know someone, or someone you know knows someone, 7 degrees of Kevin Bacon type thing here, that is having a hard time in this economy, struggling, and every dollar helps. What about $202.90? What about $405? You think that would help on a monthly basis? Yes, absolutely. How do they get that back in their check? The Medicare Savings Program. What it is, it's for people that, just like that, are struggling. Low income, low resources. They're having a hard time, and we hear it all the time. They come into the live queue and they say, I just can't afford it anymore. I'm going to just go ahead and refuse my Part B, and whatever happens, happens. No. Please reach out to your Medicaid office, your state Medicaid office, whatever they call it in your state. Arizona, it's Access, and Medi-Cal, and Massachusetts is Mass Health, and Denali Care, and there's all kinds of it's all Medicaid. It's all the same thing, just different names. You reach out to them and you apply for Medicaid. And if you're approved for the higher levels of Medicaid, there's several different levels of Medicaid. If you're approved for the higher levels, they will pay for your Part B. So that puts an extra $202.90 at the very least back in your pocket, because if they pay for that, then they usually pay for some other stuff. Depends on what level you get. They pay for your Part D and prescriptions and all kinds of other great benefits out there. One of the problems going forward with Medicaid is a lot of people are going to be kicked off of Medicaid even if they're 100% eligible. Because we're going to see this thing called bureaucratic disenrollment, where states, because the one big beautiful bill cut close to $1 trillion out of Medicaid, and they say, well, it's fine. That's, if we kick off undocumented immigrants on Medicaid, then we'll say that's $1 trillion savings. The only problem with that ain't true. Federal money did not go for that. Some states have decided to pay health insurance for undocumented immigrants, but it wasn't federal money that was used. There might be a small little case there, but it's illegal to have federal money pay for undocumented immigrants in terms of Medicaid. So that was a distraction, a trick that politicians used to cut $1 trillion. So states are going to start cutting back services for those people on Medicaid. They are going to start downgrading people. If you were in the higher levels, the QMB or the QI or the SlimB, they might cut you down. And one day, it's like, okay, they're paying for $202.90, and then they downgrade you because of whatever, or they just kick you off completely. The key to that is fight back. Because there's going to be a lot of people that are 100% eligible for Medicaid, but the states are going to, as we used to say, accidentally on purpose, kick you off of Medicaid. I think I've got a little slide here that shows what's going to happen here. So this is the goal, is to cut funding, cut resources for offices throughout your particular state that help people with Medicaid health insurance. And rather than have enough people there to do the job right, they just cut it back. And that's the goal. They have one person deal with 4, 5, 6, 7,000 cases, and stuff is going to be dropped and people are going to get denied, even if they fill out the paperwork 100% correctly and they're 100% eligible. It just falls through the cracks. How do I know that? Before I worked at Social Security, I worked for the Department of Social Services doing Medicaid and food stamps, and they were already way understaffed when I was there. And Social Security, same type of situation. Elon Musk and Doge took a chainsaw to Social Security, but I'll talk more about Social Security itself tomorrow. All right, so Medicare savings program. So reach out to all those people that are struggling and have them apply for Medicaid, and if they're approved, another $202.90 and other good stuff in their wallet. So it's a beautiful thing. Dual eligible. So if someone is approved for Medicaid and they have Medicare, you can have both. That's what a lot of people out there are missing. They say, well, I have Medicaid, so I can't get Medicare. I have Medicare, I can't get Medicaid. I have Social Security disability, and therefore I can't get spouse benefits. I have Social Security disability, and therefore I can't get surviving spouse benefits. 100% incorrect. Dual eligible. That means dual eligible means you have Medicaid and Medicare. And if you are on dual eligible, you have special enrollment periods. They're changing all the time. There's limitations for 2026, but if you have a dual eligible plan, that means a Medicare Advantage dual eligible plan, you're not happy with it, you just might have another opportunity to change it. So a lot of the people that change their plans, they changed them from October 15th to December 7th. But if it turns out your plan is not working for you, you might have a special enrollment period. If you have a dual eligible plan, you probably have a better opportunity to change your plan if you need to change your plan. You can also review your plan in January, February, March if you turned out you forgot to give your doctors or prescriptions. One of the things about choosing a Medicare Advantage plan is I call it the 7 Ps. For a Medicare Advantage plan, you need to make sure, you compare it with what you got, all your providers. So there's going to be a lot of people out there that they switch their plan, but they forgot, I forgot this provider, and that's the most important one, and my new plan doesn't cover it. You get a mulligan type of chance, January, February, March. And the most important part here is persistence. I'll talk about here a little bit. You can reach out to Chapter, and they support our channel, all our free resources, so we appreciate them. All right, veterans. Being an old Marine Corps sergeant myself, kind of soft on veterans, make sure we take care of our veterans out there. And veterans come here all the time during the live Q&A, says, I can't afford, Part B. And I don't want it anyway. It's a waste of money because I use the VA. Okay, perfect. If you're 100% happy with the Veterans Administration health, then you're happy with it. So nobody can convince you otherwise. So they say, I'm just going to go ahead and cancel Part B because I use the VA. Okay, that's what you want to do. But as long as you are fully aware of the repercussions, because, okay, you're 100% happy with the VA, your local VA hospital clinic right now. Okay, beautiful. But, a few months ago, they tried to cut over $80,000 positions, people from the VA throughout the country. And luckily we protested and stopped that, but they are still going to, by attrition, cut 20 to 30,000 people and every year continuously. And they're cutting back the budget. So you might be happy now, but will you be happy next year? And what happens if you move? What happens if you need a second opinion? So I would seriously think I would seriously, I mean, take a serious, note and say, hey, is this the best thing for me? In case I move, do I really need to, stop Part B? And this goes for people living overseas as well. If you live overseas and I don't want Part B because I'm not going to use it. But if situation changes in the future and you do decide to use it, then again, you're going to get the penalty. 10% for every 12 months you didn't get it when you were supposed to. And you can't sign up for Part B until January, February, March. So people living overseas or veterans or whatever, and they say, oh, the VA closed down, my doctor left, and I really need to go see somewhere else. And it usually happens in April or May. And I need to go ahead and sign up for Part B. Sorry, can't do it until January. There are very, very small exceptions, but January. So if you have to wait till January, and then you sign up in January, and your Part B will start February 1st with the penalties for the rest of your life. So be very, very careful. So if you're having that hard of a time, same thing, veterans, if you're having that hard of a time paying for your Part B, refer to the top Medicare Savings Program. And there is what's called the Part B I forgot to show that. Refer to the top, the Medicare Savings Program. You can, I've decided, I've always tried to, in these videos, tried to be on point as much as I possibly can. But there's about 20 different AI channels that have popped up that people can't determine whether the people talking, there's people that are, Dave Ramsey. There's an AI, Dave Ramsey. That's not him, obviously. There's someone standing in front of a Social Security Administration sign, which not Social Security Administration. These AI channels are popping up. Hopefully they do something about those. But I've decided I'm just going to be the old MTV Unplugged. That way you can know, okay, this guy, he's got really terrible jokes, and he's anyway. I know he's not AI because nobody in their right mind would make an AI that looks like this or, talks these stupid stuff. Anyway, so I guess that's my solution to prevent, to let people know I'm not AI. Okay, let's get back on track. Part B give back. These are Medicare Advantage Part B give backs. And for those new people out there that say, oh, Ed likes Medicare Advantage, I always recommend checking out Medicare supplement plans first. Plan N, Plan G, Plan F, Medicare supplement, Medigap. But there's just a lot of people can't afford them. And so it is a reality out there. Over 50% of people get a Medicare Advantage plan, and more power to them, but there's a key to those. All right. So Medicare Advantage Part B give back. And most of these are specifically directed to veterans. So if you've got a veteran that you know of, you're a veteran, got a veteran that you know of, you're trying to help out, their Medicare Advantage, if there's one available in your area, that's called, it pays for, as the name implies, it pays for part of your Part B, $50, $100. I haven't seen, nobody's told me yet. Let me know, is there anybody out there in the country, any area of the country, because they're all, area specific, for 2026, is anybody receiving one of these Part B give back that pays all of the $202.90? I don't think I've seen any yet, but let me know. Let me know if you're receiving one of these, how much you're receiving back, 50, 100, 175 or whatever. But that's what they do. And they're focused on veterans. They're named honor plans or patriot plans. And because veterans love these because they predominantly use the VA, and they have Medicare Part B, they're avoiding the penalties, but they're not paying a whole bunch for it. So there might be one available in your Medicare Advantage Part B give back. So you can reach out to Chapter and they can find out if there's one available in your area. So, all right, IRMAA. Too many people wasting money. You're about to get, if you haven't gotten it already, you will receive the IRMAA letter for those people that made a lot of money in 2024. It's based on 2024 earnings. It's called the Income-Related Monthly Adjustment Amount. And you're paying a higher premium for Part B and Part D. There is things called life-changing events. So if you get that letter and it says you are not going to pay $202.90 like everybody else. You're going to pay $400 or $300 for your Part B and extra for your Part D because of how much you made 2 years ago. Remember, on the bottom of that letter, it says you can appeal this if you have a life-changing event. And one of those life-changing events is you've stopped working or reduced your hours or got divorced or whatever the case may be. So make sure you fight that. It's an SSA 44, the life-changing event form. And those take a while. Those always take a while to get adjudicated, processed at Social Security. But if they don't do it until, let's say, March, April, or June, or whatever the case may be, they will refund your money going all the way back to January. If they decide, oh, yeah, this person should have never had to pay the extra premium, they'll go back and give you all that money back. So extra help. Here's a big one. Extra help with the Medicare prescription drugs. If you got someone that's having a hard time paying for their prescription drugs, make sure they apply. This is like one of the easiest applications at Social Security. Super, super easy application. Needs-based, low income, and you get help with your prescription drugs. The max you can pay for 2026 is what, $2,100. But that's a lot of money. If you get this extra help with the prescription drugs, also called the LIS, the low income subsidy, then Social Security, Medicare can help you out with your prescription drugs. And there's a new thing that's automatic for 2026. It's been around for a year or two, but this is the first time it's automatic. It's called smoothing. If let's say that the max you have to pay for your drugs is, let's say, $2,100 for the year, but your drug is so expensive, you reach that cap in January. So they don't expect you to have all $2,100 in January. What they will do is they will automatically smooth. So they will say, okay, your max $2,100, you have to pay that in January. We'll just go ahead and divide it by 12, and you can pay it a little bit, a couple of $100 every month, whatever, for the rest of the year. So that's a nice, helpful thing. Before you had to ask for it and all that stuff, but now it's automatic. But since this is the first time it's been automatic like that, I'm figuring there might be some mistakes. Let's keep an eye on that. So if you get smoothed, that's what they call it, let us know if you're having any issues with that. All right. Another thing, Medigap price check. We had the annual enrollment period before October 15th to December 7th, and people switched from Medicare Advantage to another Medicare Advantage, checked their Part Ds, switched from Medicare Advantage to a Medigap plan, Medicare supplement plan, same thing. But those people with Medigap plans, Medicare supplement, if you have an F, G, N, whatever you have, you can actually switch that plan 365 days of the year, depending on your state and depending also whether you're healthy. So if you're healthy-ish, and if you look like you might be able to pass what's called medical underwriting, health underwriting, and it's not a physical or anything like that, it's just some questions. So for instance, if you call Chapter and say, yeah, I've got a Medicare supplement plan G, and is there one cheaper out there that's still, a reputable company, or I've got an N, I want to switch to a G, or a G to an N, or an F to an N, or whatever the case may be, then they will see what's available in your particular state and then ask you some medical questions, because it depends on your state as well. Some states, they don't ask the medical questions, but at other states they will. Because it's not a mandatory thing that they sign you up, but a lot of people could save some money every single month if they price check their Medigap plan. So make sure you do that. All right, here's a big one that our team, all our new members in our team, I know there's a lot of new people out there that's officially going to join our team. And this is extremely important because there's going to be, 20 million people losing their Affordable Care Act. And, everybody out there. It's called charity care. And this is actually part of the Affordable Care Act. So when the Affordable Care Act came in, there was a bunch of provisions. People don't understand the Affordable Care Act at all. They have no idea what it is. Marketplace, Obamacare, people just don't understand what it is. But one of the things that was in that is it's a 501R. It basically says, the Affordable Care Act says, hey, you nonprofit hospitals out there that don't pay taxes, sure, you're loving that. They're nonprofits and they don't pay taxes, but they still pay their CEOs and a whole bunch of money, millions of dollars and stuff like that, but they don't have to pay taxes. So the Affordable Care Act says, okay, you don't have to pay taxes. We want something from you. We want you, if you're a nonprofit that you're supposedly out there taking care of the community, because you're doing the good thing, the right thing, we want you to take care of the community, do the right thing and do the correct thing. And if someone comes to your door, your hospital, and they're not able to pay, we want you to give it basically that care for free. Charity care. So there are, depends on the particular area and all that. So here's the homework everybody needs to do. You need to find out which hospitals in your area, contact your friends and relatives and everybody and say, you need to make a list. I know you're struggling, you ain't got a lot of money, you don't want to go into, medical bankruptcy and stuff like that and all these issues, suck the last few dollars of your retirement, because of some bills. Find all of the hospitals in your area and list them based on whether they're profit or nonprofit. And put that list to the side and say, hey, honey, mom, dad, uncle, grandpa, later, little old lady next door, whoever, if anything should happen to me or you, and there is a choice between a nonprofit and a profit hospital, take me to the nonprofit one, because then, if you take me to the profit one, the for-profit, then they're going to come after me forever and have to go bankruptcy and suck up all my money. And then I'll be, destitute, retirement, stuff like that. So if there's an opportunity to, if there's the same distance or closer or 2 minutes, if 2 minutes extra doesn't make a difference, take me to the nonprofit one. So we need to do that now. Make a list, check it twice, all that kind of good stuff. For all your friends and family out there. So please share that. Let me pop up that one time. Maybe take a screenshot of it or something. And that way you remember it. So you're looking for nonprofit hospitals. And they're supposed to, part of the Affordable Care Act is those nonprofit hospitals are supposed to list that they're nonprofit and they provide this stuff. And they're supposed to list that dominantly on their website. So it's not hidden in the, the small details and stuff. So please get that done. Help your family, friends, and all that. All right. And the last thing is persistence. These health insurance companies, their number one method is to wear you down. That's it. Medicaid, same thing. Unfortunately, Social Security, AI and everything, same thing. So with everything, you have to stay persistent. With the Medicare Advantage plans, you get the prior authorizations and you got the networks and all this stuff. You have to stay persistent and don't, so wrong slide there. Don't say, well, I don't want to push because my Medicare Advantage plan is 0 premium. So I don't, look a gift horse in the mouth and no, you're the gift horse. So look in the mirror, I guess. Did I just call you a horse? Anyway, sorry about that. When you sign up for a Medicare Advantage plan, what happens is whatever company you sign up with, XYZ Medicare Advantage plan, they sign up and they say, oh, we're so awesome. We're not going to charge you anything. It's going to be free. It's not free. It's 0 premium. You're paying for it. You're paying for it with the $202.90 you're paying every month. You're paying for it all those decades you paid into FICA. You're paying for it when you pay taxes. And what happens is when you sign up for XYZ Health Medicare Advantage plan, they go to Washington and say, hey, we just signed this person up. Give us, if you're an average enrollee in an average part of the regular part of the country, they give that company $1,000 a month per member per month. So you are essentially paying $1,000 a month for that Medicare Advantage plan. If you're sicker, they charge more, 15 to 2,000. If you're very sick and live in a very expensive area, $2,500 or so. So you are paying for that. So when they provide gym membership, use it, not just for the first 3 days of January. I think that's written in the Constitution that everybody signs up for the gym and they only lose it for 2 weeks. So I think that's our constitutional right to do that. But everything else, if they give you dental, use it. If they give you vision, get your glasses, and then fight for it. If they say, no, we're not going to approve this procedure that your doctor says you need, fight for it, because you're paying $1,000 a month for that.